Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. This is part of our a two-part show. And we're dealing with CPR, we're dealing with first aid and AED training. In the last episode, we talked about CPR. We did a CPR demonstration. This time, we're talking about first aid. Our guest today is Trica Young and Mattie Gantz, and they're specialists in this area. And so today, in starting off talking about giving first aid, let's talk about people with allergies.
Okay. So a lot of people have allergies, and they can be on one end of the spectrum versus the other. So an example of the allergies that we talk about when we're teaching our classes are allergies that we call, and they're known as anaphylaxis. So anaphylaxis is a big word for a really bad allergy. Your body reacts really badly. So for example, you may have an allergy to nuts. And when you're exposed to nuts, now you may not have to eat it. It could touch your skin. Some people are really allergic like that, where it touches their skin and they might get hives. Their nose starts to run a lot. They have a hard time breathing. And so what we do for those people are that most of them carry EpiPens. And EpiPens it's a dose of epinephrine, and we basically administer it to them, and it lasts for about 10 to 15 minutes or so.
What does it do?
It will slow down the reaction, okay, to that allergen. They are definitely, whenever you administer an EpiPen, you must go to the hospital. The EpiPen, again, is only going to give you, depending on your body, like 10 to 15 minutes. So most people carry 2. So that will give them enough time to get to the hospital.
And if we're dealing with a child, is it the same remedy?
It is. So this is only a trainer, but there's an EpiPen, and then there's an EpiPen Junior. They're all called really auto-injectors, but the biggest auto-injector out there is usually the EpiPen. They also have some that are smaller, and they talk to you, and it'll tell you, okay, go ahead and press it. But they do the same thing. It gives you a little bit of extra time so that you can get to the hospital and get advanced care.
Where do you put the EpiPen, or how do you inject it, or how does that work?
Okay, so most likely when people are having a serious allergic reaction, anaphylaxis, they'll be able to tell you, I think I ate a nut, or there was a nut in something, for example, and you won't wait for symptoms. You don't wait for hives. What you'll do is, and I'm going to demonstrate on Mattie, EpiPens, or these auto-injectors, have a long needle, and so you don't have to worry about taking off any clothes. Whether you have jeans on, pants on, it'll go straight through it. So that's one big thing. It saves you time. Don't worry about taking clothes off. You want to get this into them right away. So we're going to go right into this area, okay? So anywhere in this area, and again, this is a trainer, so, but they all do the same. The EpiPen Junior for your kids is just a smaller dose, okay? This is the adult dose. So what you'll do is, I like to just take off the safety cap while it's on my victim's leg, so that there's no chance of me getting stuck with it. If we were to get stuck with it, we'd be okay, but she wouldn't have the medication she needed. So I like to keep it on their leg, and then what you'll do is you'll just push it in.
Clicks.
Okay, you heard the click, right?
Yes.
So I just count 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. And then you see where this orange is? That's where the needle will be. Okay, so you can just rub that in there. If it is a child, you want to make sure you're not sitting where Stephanie's sitting. We have a lot of soccer players, okay? A lot of soccer players. So make sure that you're not sitting where Stephanie's sitting. So what you'll want to make sure is also that you have someone sitting with the child. It is a needle. They probably aren't going to like it. If it's a child, you know, just because we work with kids a lot, you may want to wrap your arms around them.
Put their
make
feet
sure
on
no
yours.
one's standing in front. And you see how I'm at the side. So Mattie could be standing up, or she could be sitting down. If she was a child, I might have Stephanie preoccupying her and talking to her, and then just go in for it.
You
right?
always write the time down that you gave the EpiPen, because in about 15 minutes or so, you may have to give it again.
Yes.
So when EMS arrives, they'll know what time you gave it and all that.
How long does a reaction last? Can a reaction last? If you're having a reaction to seafood or peanuts or whatever.
Unfortunately, we can't really answer that, but what we can answer is this. You can have an initial reaction, and the reason that you always have to go to the hospital is there can be another reaction that comes behind that. So that's why it's crucial, even if you use the EpiPen, that you get to the hospital, because you're going to need to probably get some medications that are going to slow down the next reaction, and also make sure that the next reaction isn't worse than the first one.
When you're dealing with a victim, why is it important to wear these gloves?
Oh,
Very important.
There's so many germs and things like that floating around. You want to make sure that you protect yourself first, okay? So let's go ahead and get the gloves on, and then we'll properly show you how to get them off, okay?
Because you could be wearing gloves, but then when you take them off, you can
Contaminate yourself.
I was just going to say, and then there would have been no reason for you to have put the gloves on. So I always tell our students when we're working with them, don't be in a rush to get these gloves off, okay? Because that's the time when you will get an exposure, because it's going to be flopping all around your bodily fluids. So you'll want to make sure that you use gloves any time that you're dealing with any bodily fluids.
What if you don't have gloves?
Okay, so if you don't, great question, you don't have gloves, then you can use plastic bags, okay, as a barrier, all right? Now, I always tell people this and they laugh, but make sure the plastic bag doesn't have a hole in it. Okay. just do it, please. Okay. Make sure it doesn't have a hole in it. So we have our gloves on. Okay. We're sitting down. You can definitely stand up to do this also. So you want to make sure that the gloves are out and away from your body. Why? Because you don't want any of the bodily fluids to fall onto your clothes or your shoes. Don't worry about the floor. Okay, out and away from your body. And then what you're going to do is you're going to pull at your high palm area, okay, right here. And you're going to take that first glove off halfway. Okay, that's halfway. And again, this is out and away from our bodies. All right, and then you're going to go and you're going to pinch that other glove again at that high palm area, and you're going to take that one all the way off, okay? And I always tell my students, I'll wait for you to get
I'm having drama.
That's okay. Take it all the way
so
off.
just take it all the way off.
And I always tell my students, keep the other hand out of the situation, because what are you going to want to do? Touch it.
Okay.
So keep this hand out. And what you're going to do is you're just going to ball it up like it's a piece of trash.
Okay.
Okay? And then you're going to go underneath.
Take two fingers.
Two fingers underneath, okay? And then you're gonna pull this off. And remember, you're touching the inside, so there's no exposure. You don't have to be in a rush, just like that, okay? And then you're going to throw that in the trash, right?
Okay.
That's our trash. And then I always tell people, after you have had gloves on with bodily fluids, even though it's there to protect you, you wanna make sure you wash your hands.
With soap and water.
With soap and water. Okay, so a lot of people think that they can use hand sanitizer or the alcohol-based. You can if you're in an area where you don't, like you're camping, and you can't get to soap and water yet. You can use alcohol-based hand gel. But first and foremost, soap and water is the #1 way to get your hands washed. So whenever you put those gloves on, make sure that you use soap and water to wash your hands.
What's the difference between using the soap and water and it just gets your hands cleaner?
It does
I
get
think
your
so.
hands
Yes.
cleaner. Absolutely. And you're washing it off. That hand gel, you're just rubbing it around. But with that soap and water, you're washing everything off. Okay?
You're rinsing, yeah.
You are. And I will just throw out there too, if for some reason you cannot, and we'll get into a demonstration soon, that person, let's say, has a nosebleed and you don't have access to a barrier, which is your plastic bag or your gloves, you actually can help that person help themselves without touching them. So you could say, for example, with the nosebleed, everyone thinks, oh, you're supposed to tilt your head back. We don't tilt our heads back. No, absolutely not. Because if we tilt our head back, where's the blood going? Down here in our throats and our tummies.
So
and
what's
you have
the
people,
best thing to do?
So you're just going to sit in a comfortable position. You can be sitting like you are right now, and you're going to just apply pressure like this. Okay, you see how, and that's going to help stop the bleeding. All right. So that's something where if you don't have a barrier, you can just tell that person, okay, you're going to want to make sure that you give them nice pressure, and it's got to be a nice pressure to stop the bleeding, because direct pressure always helps to stop bleeding, okay? And anything, your nosebleed, or if you have a cut on your arm, we're always going to do direct pressure. And if, for example, the nosebleeds, especially those of us that have children, if there's a nosebleed that doesn't seem to want to stop right away, while you're giving the direct pressure on the nose, then you can have somebody get an ice pack or a bag of ice, and while they're doing the pressure on their nose, you put that ice pack up top, and that'll help out to stop the bleeding. If it bleeds too long, you're going to want to get some help and get them to the doctors.
How do you care for wounds? Whether it's a stab wound, whether it's a gunshot wound, whether it's a cut, you were walking and you stepped on top of a piece of glass.
Okay.
Well, if you step on a piece of glass, you don't want to pull the glass out. You want to use direct pressure. You want to stop the bleeding. So once you stop the bleeding, you may have to work around that. Depends on how big it's a big piece of glass. You may have to work around that big piece of glass, but you want to put direct pressure and put a pressure bandage on the area.
But for example, if you were stabbed, you don't want to pull the knife out.
No.
Because I think that's the automatic reaction for people is to want to pull out whatever you've been impaled.
You want to leave it there. You want to press down on that person. You use a lot of your weight. You want to get the blood to stop, and then hopefully you'll be able to put a bandage around. Okay. 911 calls.
Always.
Always.
Especially for these deeper wounds. You want to make sure they're losing a lot of blood. That's a life-threatening event. Any life-threatening events, we always want to make sure that we get some advanced medical care to that victim.
Is there a difference in treating a gunshot wound opposed to treating a stab wound? Is it the same concept?
It is. We're looking at more of the blood. So if there is a lot of blood that's coming out, you just want to do your best to get, and again, we're calling 911 first, but you want to do your best to make sure that you can help stop the bleeding. Because once the blood is gone, it's gone. You can, get some help later on once you get to the hospital, but on that scene, you want to make sure that you can help stop the bleeding.
And the worst thing to do is just stand there and watch the person bleed. You want to use direct pressure.
You want to respond.
Do something
immediately.
And I'll say this, because when working with students, some people say, oh, well, what if I can't help them? And maybe sometimes you aren't able to help as much. The number one way that you can help a person is to call 911 and get the paramedics there.
We all have our cell phones. So you are still
helping.
Yes.
You are still helping. So don't think that you're not doing anything. Calling 911 is the first step that you take.
Exactly.
Is there an optimal position to be in if you're treating someone? If someone has a stab wound or a gunshot, should they be sitting up? Should they be lying down? Should they be lying to their side? Is there an optimal position that they should be in?
Well, I wouldn't really say there is, and especially if they're more comfortable sitting like this, or there gets to be a point where you want to also just make sure they're not going into shock as well.
What are signs of that?
Their skin might become clammy, cool, their coloring changes. So depending on their complexion, they may get lose color and it might become a bluish, or it might become ashen in color in our browner skinned people. So when you see symptoms like that, then again, we have to call 911 because things can get bad quickly.
Right.
Yes, and that's a point I want you to make as well. Things can, at the drop of a dime,
They really
Right.
can.
things can turn.
You want
really
to
can.
let the person sit down. You're not going to say, I think you're going into shock. You just let them sit down, elevate
and
their
what
feet.
we also teach them when we're working with shock is also to let them know, you know what, help is on the way.
Yeah, reassure.
Reassurance goes a long
way.
way. We're going to get some help here for you. Just sit and relax. Things are going to be okay. Trying to keep them calm is big.
That is very important. The mental piece is just
It
as
is,
important.
because they talk about people feeling like they're doomed, or because if you think about it, if we were in a situation and we knew that we had a really bad injury or condition, we would be scared. Am I going to die? Things are going to be okay. We're getting help here. It'll be here soon. Oh, you can hear the ambulance coming. They're going to make sure that you get taken care of. This reassurance goes a long way with people.
If the person does go into shock, is there anything you can do at that point as a CPR specialist?
Well, there
First aid
is a shock position. So basically, you'd have them lie on their backs
Raise their feet.
if they don't have any injuries on their legs.
Yeah.
So they'd lie down on their backs. You'd raise their legs up 6 to 12 inches.
What does that do?
It just helps keep them in a better position of, one, rest. Two, you'd also make sure that if you have a blanket or something, you'd be able to help keep their body temperature at a good place.
If you're
Hopefully by
standing
that
up, the blood
time-
is going, because of gravity. You don't want to be standing up because all your blood is going.
And hopefully
towards the
by
floor.
that time, the paramedics will be there.
Yeah.
So we're going to do some demonstrations
Sure.
dealing with wrapping a wound and making sure that you put pressure on
Yes.
a wound. Also, it will show once more the EpiPen and how you treat that as well.
Sounds good.
And making sure you put on your gloves. And if you have a paper bag, something, cover your
Plastic.
plastic
bag.
Okay.
No, you know what? And it's great, Stephanie, because I always tell our students, and when I say students, those are students from 13 on up, that this is our learning laboratory, so I'd rather us make mistakes here. That way, when we go out in the field, we're like, wait a minute. I know it's not supposed to be a paper bag. It's got to be a plastic bag. So we want the mistakes to happen here. Okay? Because no paper bags, only plastic barriers, and they come in the form of gloves or maybe a plastic bag with no holes in it. Okay? No paper bags for anything.
All right. So let's do an example
Okay.
of dressing a wound.
Oh, well.
Okay.
So what happened to you that you have this wound?
Okay,
happened, Stacey?
so
What happened, Trica?
I came in and I was outside and I somehow fell down and I think a branch hit my arm and it's bleeding.
Okay, is it okay if I take care of you? I
Yes,
have first
so
aid
this
training.
is first and foremost, whenever we are working with a responsive victim, and that means a victim that can talk to us, we always want to let them know we are, well, in our case, first aid certified or CPR certified, and ask, is it okay if we can help? Okay? Sometimes people say no. Oddly enough, okay?
That's
so
interesting.
let's throw that out there real quick. So if they say no, and it's interesting because they may have hit their head and maybe they're not thinking straight. There are different reasons. Maybe their blood sugar could be low. Anything where they might just say, no, I don't want help. People get embarrassed and they say, no, I'm okay, I don't want any help. The one thing, if you really believe that they need help, the one thing they can't stop you from doing is calling 911. So you can call 911. Do not put your hands on them. Okay, because that's just like if I didn't want someone to touch me and I said don't help and someone came and it wouldn't work out well. You might have 2 victims now. So make sure you don't put your hands on them. You always want to make sure you get permission.
Okay.
Okay. So I have a
okay
cut
if I
here
help
on
you?
my arm. Yes, please.
Okay, can you just hold that for me? We're going to put some pressure there. Can you hold that?
And this is an example of how maybe if Mattie didn't have gloves, she could walk me through. And I am, since the cut's here, I'm putting my fingers
Direct
on top
pressure.
of that. And it's making like a sandwich with my arm. Okay?
Perfect.
I'm going to leave a little, we call it a little tail hanging down. You're going to see what I'm going to do with it in a second.
And whenever we're doing this, realize that when people are, they see blood, a lot of people get worked up, especially if it's their own. So we found that when we ask the person to help themselves, it gives them something to do rather than just think, oh my goodness, I'm bleeding. Okay, hold this here for us while we go ahead and help you. Okay, so now Mattie's just going to use that tail and tie it off. Just like that, okay?
And if I see she's bleeding through,
And let's say I'm bleeding
Still
through,
bleeding?
we're not going
Not
to
gonna take it
unpeel
off.
anything off. We're going to just add on to
add
it.
on some more. Yeah.
Now, if the person has something in them, like if there's a piece of glass hanging out,
Right.
there's a knife hanging out.
Okay, there we
Very
go.
good, great.
There's
example.
something.
You don't pull it out. You just want to
You're
work
just
around
going to
it.
wrap around. Let me turn my arm there so you can see.
Wrap around
Okay,
it.
so you're just going to be wrapping around it.
How tight should it be?
Okay, so that's a great question. It needs to be tight enough where you can get 1 to 2 fingers at the top and 1 to 2
Two at the
fingers
bottom.
at the bottom.
Okay.
So you aren't cutting off any pressure. If you see that their arm is starting to turn colors or their fingers, then it's on too tight. You need to loosen it up. But usually the best gauge is you can get a finger above and a finger below.
How about, for example, if you're in a camping episode, let's just say you and your family, you've gone camping and something happens and you don't have that. Do you use clothing? What else can you do?
You could use clothing. I just want to introduce this idea. Most people should have some type of first aid kit.
Right.
It does not need to be in those fancy plastic boxes with all these different things in it. It can be something as simple as this. I have kids that do sports. I just have a gallon-sized baggie. I throw in Band-Aids, gloves, tissue. You can go and get gauze from anywhere because it does help with stopping the bleeding. So
If
help
you're
stop
going
bleeding.
camping, you should have your own first aid
kit with you.
Okay.
Yeah.
You should. For
Okay.
sure. If you're going camping, if you're going to a sports event, I also throw in my little kit.
If you're going to a sports event,
Yes.
why?
Because especially when it's been my kids, somebody always has a little bumper bruise. We have a little, they have these ice packs now that you could just
Crush.
you crush and you shake it and it turns cool for them. You never know when you'll need those gloves. And that's, remember, our first way to keep ourselves protected. And you never know when you'll need some gauze or even some of your Band-Aids. Something as simple as that. So I'd say even sports events.
And the reason I mention that is my sons wrestle.
Oh.
Somebody always gets a nosebleed.
Exactly.
Somebody always hurts their knee
Always.
with the ice, what you were talking about with the ice
Yes.
packs. And do you know how many times I've seen people with the nosebleeds go like this?
Yes.
No.
So that was some real good information
I'm glad
about
that you
that.
learned
But
something.
something always happens.
Happens.
There's always
Yes.
something.
Yes.
And as moms, we had kids that were in sports, so we always had our little first aid kits. If something
In
would
our bag.
happen, in
Something
our
very
bag, we
simple.
would run out and
Yeah.
That you can
Okay.
put anywhere. Like you said, you don't have to get the little fancy
No,
kit.
I have mine in a Gladlock baggie, in this baggie, so that I can toss it in my purse. And they're like, oh, we know she has some Band-Aids. I say, I do. Who needs one now? Because there's always something. Always something.
Yeah, and also the glove things are good too, because I always see people with the whole wrestling thing, they're cleaning the mat.
Yeah.
Somebody got a nosebleed on the mat. Somebody got a cut on the
Right.
mat.
Yes.
So they're always cleaning the mat, but make sure your hands don't
Your hands
touch
are
have to
safe.
get
somewhat a
protected.
stranger's fluids.
That's
Exactly.
it. So you want to, your emergency kit that you carry with you is going to be quite different from the one that you keep at home with different things in it. But definitely you must have your gloves.
Your
You
ice.
must have, also it's good to have some tissue in there, gauze. Because with
Bottle
your
of water.
nosebleeds, you can
Bottle of water.
easily pinch the nose with tissues. Those are simple things you throw in your purse, throw in your workout bag, and keep going.
We tell our schools the only reason you're holding your head back is so building services doesn't have to clean the floor. It's not necessary. Pinch it off and run to the nurse. You don't have to go like
That's
this.
it. That's it. No, please.
Okay, and wrapping up our show today, what is your main advice when it comes to treating wounds or emergency situations? And I know what you're going to say. What is the number one thing to do?
When it's a
Gloves.
life, yes, we
Well,
got to put your gloves
Your
on
gloves.
first.
Keep yourself safe.
Second, any life-threatening event, make sure
911.
you call 911. Always.
You said something at the beginning of the show, or I think at the beginning of the last show. I want you to say it again. Be specific when it comes to your location.
Exactly.
You've called 911, but you're in a big building.
Very, very specific. So that means they're going to say, where are you? I am in this building on the second floor in room 203.
Right.
You cannot get more specific than that, one. And two, if you have an extra person that isn't helping you, send them down to that main entrance and have them bring the paramedics up to where you are. Those matter of few minutes that you're saving could be life-saving.
And if you're doing CPR on a person, you work until the paramedics tell you to move. What some people will do, they're trying to help someone. As soon as the paramedics walk in, they step back. Those guys have to get set up. So they'll tell you when to move. You just do what you need to do,
with the
and they'll tell
CPR,
you.
we'll always want to make sure you're on a hard surface. So
Yeah.
if they're on a bed,
Pull 'em
you're
off.
not going to be able to do compressions. Their body's going to go into that bed. You got to get them down to a hard surface. If they're on a chair, do the best way you can. Go underneath their arms and get them down on the ground. Again, this is just for demonstration, but we highly advise any parents, citizens, community members, sports spectators to get certified.
And it's not a long process.
Absolutely not.
No.
First aid takes a few hours and CPR takes a few hours, but it can save a life.
Now, so what we're going to do is at the end of the program, we're going to put all of your information up, and they can check you out and find out how to get certified. As we just mentioned, it is not a long process,
Absolutely.
but it is a life-saving process.
Absolutely.
We've been talking to Trica Young and Mattie Gantz and their CPR and first aid and AED
Yes.
specialists. And I thank you ladies for joining me today.
Thanks for having
you.
us.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.